Hello. In the last video, we talked about what are hemorrhoids or piles, how they are caused, and what symptoms they produce. In this video today, we will see about how to treat the hemorrhoids when they happen to cause significant symptoms. The most important thing to remember is that lifestyle management is the basic method by which one can comfortably reduce or even make the symptoms disappear altogether if the hemorrhoids are of a small early type. Even in severe higher grades of hemorrhoids, lifestyle management is a very useful adjunct to other types of treatment. A good fiber-rich diet, avoiding constipation, taking laxatives as and when desired, as and when needed, and use of some localized relieving creams can all contribute to the relief of symptoms, sometimes, as I said, leading to their complete disappearance. For some types like the type 1 and type 2 that we discussed last time, an additional method is called as banding of hemorrhoids. Now, this is a method in which specialized rubber bands are applied to each of the hemorrhoidal swollen bunches of veins, such that over a period of 7 to 10 days, the hemorrhoidal bunches shrivel up and drop off along with the rubber band, leaving a small scar behind which disappears over time. Sometimes one can also use injections of materials called as sclerosants, which will more or less do the same thing. However, if the injections are not given in the proper site, or if too much of the injection material is given, or if it is given too deep, there can be quite a bit of pain following the injection, and therefore I do not practice injection for hemorrhoids at all anymore. By and large, treatment for at least type 1 and type 2 hemorrhoids is usually a office procedure or a day procedure, in the sense that over a period of a few hours after the treatment, the patients can usually go home. At the most, they may need to stay overnight. In the case of type 3 and type 4 hemorrhoids, meaning the larger ones, sometimes it may be not enough to do something simple like banding. The gold standard for a long time used to be what is known as classical hemorrhoidectomy or Milligan-Morgan hemorrhoidectomy. And in this procedure, the hemorrhoidal bunch of veins along with the overlying lining of the anal canal and a little bit of the perianal skin is removed, and the base of the hemorrhoids, where the blood vessels are feeding it, is tied off. The problem with this procedure is that there are open wounds that need to be left behind, and even if the wounds are approximated and closed, there can be considerable amount of pain which does not quite sit in well with most patients. Therefore, this gold standard operation over the last many decades has more or less come to be used only if there is a necessity for doing other procedures along with removal of hemorrhoids. We will see about that later in another video. There is also the use of a thing called Cryoprobe Application, which is an instrument with a very, very cold tip, and that can cause the hemorrhoids to suddenly freeze and over a period of time shrivel up, just as with the band application. This is also a good procedure, but more often than not, it may be not possible to treat all patients of type 3 or type 4 with this kind of method alone. The gold standard procedures I just now talked about and cryotherapy, all these have been supplanted by the development of very comfortable and very scientifically based new procedures. One of them is called stapled hemorrhoidopixi, in which a circular stapler machine is used with the patient under some form of anesthesia, and it removes a strip of the lining inside the anal canal, at the same time disrupting the blood flow to the hemorrhoidal masses, and thereby this completely allowing the hemorrhoids to disappear over a period of a few days. In addition, because it removes a strip of the lining mucosa and reunites them all in one go, the portion of the hemorrhoids that was outside the anal canal also gets pulled in, giving what could be called as a facelift, if you want, for the bottom end. A similar procedure, even more scientifically done, is with the use of a wire ultrasound probe. This is called hemorrhoidal artery ligation. In this procedure, a special instrument is used, and with the use of that wire ultrasound probe, the feeding blood vessels are exactly located and tied off with specialized suture material. In addition, it can also be used to lift up the prolapse like in the previous procedure I described, so that the final effect is one of getting rid of both the hemorrhoids as well as lifting up the portion of the hemorrhoids that had prolapsed outside. In both these procedures, the hemorrhoidal masses disappear over a period of time, and the surgeon will usually send the patient home after making sure that there is no bleeding or significant pain. There is a brand new procedure called laser hemorrhoidectomy, or the use of a laser beam to completely destroy the blood vessels and the swollen area. And this is a very good procedure, perhaps a tad costlier than the others. However, if done well, the patients can have the maximum benefit of hardly any bleeding and significantly reduced discomfort, and they also can go home soon after the procedure, most likely, most often within the few hours, or at the most after 1 day of stay in the hospital. To summarize, treatment of hemorrhoids is effective in most instances. In early stages, even no treatment may be required in the form of any surgical procedure. But given the nature and the location of the hemorrhoids, the possibility of recurrence always exists. The reassuring thing is that many of these procedures can be done again and again in case the hemorrhoids come back without significantly setting back the patient's health in any way. They are all short procedures and require very minimal anesthesia, if at all. The most important thing to remember, however, is that lifestyle management before and after surgical treatment of hemorrhoids is the most important single thing for a final, successful and long-lasting outcome. Very rarely, despite all these efforts, there can be the possibility of a complication. Sometimes, in special situations, we may have to do things different from what I have just talked about. We will see about these potential major complications and the special situations in the next video. Have a good day.